Hey everyone, welcome back to the channel. Today, we're diving into a topic that is close to my heart and affects millions of people around the world. It's about mental health, but not just the usual talk about therapy or medications. This is about breaking barriers and embracing a revolutionary approach, harm reduction practices. Let me tell you, this video isn't just for those who are on their own mental health journey. It's for friends, family, advocates, professionals, everyone who wants to build a world rooted in compassion, understanding, and real solutions. So, get comfortable, grab a notebook if you'd like, and let's explore how harm reduction can take us beyond traditional treatment and towards something truly transformative. Alright, let's start with this. What comes to your mind when you hear the words mental health treatment? For many people, it's therapy sessions, prescription medications, mindfulness apps, and maybe even hospital stays. These are valuable tools, but here's the thing, not everyone fits into these traditional systems. There are individuals who feel left behind, judged, or even punished because their healing doesn't look like what society expects. That's where harm reduction comes in. Harm reduction says, we meet you where you are. No judgment. No shame. It's about progress, not perfection. It's about safety, not punishment. So, what exactly is harm reduction? Let's break it down. At its core, harm reduction is a set of strategies and philosophies designed to reduce the negative consequences of certain behaviors. It's most commonly associated with substance use, but it's so much more than that. It's a human-centered approach to mental health and well-being. Let's say someone struggles with substance use or self-harm. Instead of forcing them to quit everything immediately, harm reduction focuses on small but impactful changes. This could mean using clean needles, accessing safer spaces, or even getting someone to commit to one healthier choice a day. But here's the magic. Harm reduction doesn't just save lives, it empowers people to see their worth, to recognize their strength, and to begin their journey toward healing at their own pace. Now let's talk about why harm reduction is such a game changer for mental health. Think about this, so many mental health challenges, anxiety, depression, trauma, PTSD, are tied to behaviors that society often labels as harmful or destructive. Whether it's substance use, disordered eating, or even self-isolation, these behaviors are often coping mechanisms for underlying pain. Here's the thing, traditional approaches sometimes overlook the root cause, focusing only on stopping the behavior. But harm reduction says, wait, let's understand the why first. It's about acknowledging the pain and building trust. For example, instead of saying, stop drinking, harm reduction asks, what's driving you to drink? How can we make you feel safe enough to explore alternatives? This shifts the focus from control to care. And let me tell you, when people feel cared for, the healing process becomes so much more powerful. Now that we've got the foundation, let's talk about some real-world examples of harm reduction practices making a difference. 1. Safe consumption spaces. These are places where individuals can use substances under medical supervision. Yes, you heard that right. And you know what? They work. These spaces have been proven to reduce overdoses, prevent the spread of diseases, and connect people to support services they might never have accessed otherwise. 2. Naloxone distribution. This life-saving medication can reverse opioid overdoses. By putting it in the hands of community members, harm reduction programs are saving thousands of lives. This isn't just about survival, it's about giving people a second chance. 3. Peer support networks. There's nothing more powerful than hearing someone say, I've been there too. Peer support groups provide understanding and hope in ways that even the best trained professionals sometimes can't. They remind us that we're never alone. 4. Trauma-informed therapy. This is huge. Trauma-informed care focuses on recognizing the impact of trauma on mental health. It creates spaces where individuals feel safe to share their stories without fear of judgment. Now, let's talk about the elephant in the room, stigma. There's this idea out there that harm reduction is enabling bad behavior. But let me tell you, that couldn't be further from the truth. Harm reduction isn't about condoning risky behaviors, it's about recognizing that people are human and need compassion to thrive. Here's a fact, shame doesn't heal people. Compassion does. When we offer non-judgmental support, we're telling people, you are worthy of care, no matter what. And that's powerful. So the next time someone rolls their eyes at the term harm reduction, I want you to ask them this. What's more radical, shaming someone into isolation or helping them feel safe enough to start their healing journey? The answer is clear. Here's the best part, you have the power to be a part of this movement. How? Start small. Educate yourself, learn about harm reduction strategies, and share that knowledge with your community. Volunteer or donate. Organizations doing this work need resources, whether it's your time, money, or even just your voice to spread the word. Be a safe space. Sometimes, the most powerful thing you can do is listen without judgment. Let someone know they're not alone. Advocate for policy changes. Harm reduction isn't just about individuals, it's about creating systems that support people. Use your voice to push for policies that make these resources more accessible. If this resonated with you, hit that like button and share this video with someone who needs to hear this. And if you haven't already, subscribe to the channel for more powerful conversations like this.